Good afternoon. We are from SGD 2, and now we will present about our student project, which is about blood group incompatibility. Next. Here's our members. Introduction. Up to now, blood types have been grouped into several kinds of classifications. The most commonly used categorization, the ABO blood group system, is used to discern A and B antigens on the blood. It is one of the most important blood type classification systems currently recognized, especially in blood transfusion practices. In the system, the presence of antigens are inherited from both parents, and they are expressed by a single gene, which is the ABO gene. The gene itself presents in three different alleles, IA, IB, IO, where I stands for the term isoagglutinogen. The gene itself encodes an enzyme, glycosyltransferase, which is responsible for modification of carbohydrates in blood surface antigens. As the name implies, IA codes for type A antigens, IB codes for type B antigens, and IO codes for type O antigens. IA and IB are in codominance, while IO is recessive to both IA and IB. Because IA and IB are equally dominant, individuals with IA and IB antigens have both antigens in their blood, as both alleles share a special dominance relationship where neither are shadowed by the other corresponding allele. In consequence, individuals with both IA and IB express type AB blood. The ABO blood type classification is a major clinical significance, as they are naturally occurring and are universal. During blood transfusion, if blood type mismatch occurs, it may come with severe consequences, even death. When an individual with type O blood is transfused with a non-type O blood, the anti-A and anti-B in the recipient's serum binds to the donor blood surface antigen, causing agglutination and potentially hemolytic reactions, as fixed antibodies activate the complement system, which in turn causes disseminated coagulation, shock, and potentially death. Next. Here are the problems of the research. Next. And here are the objectives of the research. And here are the benefits of the research.
Definition. Blood group incompatibility is a reaction caused by the binding of the blood plasma antibody with red cell antigen. In lab tests, this reaction is commonly visualized by agglutination of red blood cells. Antigen-antibody reaction can occur as an adverse consequence of pregnancy or transfusion, resulting in accelerated destruction of red blood cell. Blood group incompatibilities can be divided into two, which are ABO and rhesus incompatibility. ABO incompatibility occurs when the different blood groups collide and antibodies are produced to attack foreign antigen in the blood. Rhesus incompatibility is in pregnancy occurs when the mother has rhesus negative blood and the fetus has rhesus positive blood. This incompatibility can cause severe and immediate adverse reaction, often fatal, especially in first trimester of pregnancy. Next.
Blood group incompatibility can happen mainly during two phenomena, which are during pregnancy and blood transfusion. During pregnancy, it may happen because of the contradiction between the mother's and child's blood type, causing antibody formation that will attack the red blood cells of the fetus, which can result in ABO group incompatibility or rhesus incompatibility. Meanwhile, in blood transfusion, it is usually caused by errors in the procedure or before the procedure, such as blood type mislabeling, incorrect form filling by the donors or the receivers, and mistakes at checking donated blood before transfusion. Next.
So red blood cell has two systems of blood groups, which are the ABO system and the RH system. So anti-A agglutinins from mother will pass through the placenta and go to destroy the red blood cell of the fetus. This doesn't require sensitization, so it may occur in the first pregnancy. Rhesus incompatibility, generally when birth happens transplacental hemorrhage from the first child with positive RH and negative RH for the mother. Sensitization also could happen when a procedure of the clinical is done, such as pregnancy termination, amniocentesis, choriocentesis. The blood group incompatibility triggers the antibody to deconstruct in the mother's body. Next.
So, the pathogenesis. The first child have to experience hemolytic disease of the newborn that caused by blood group, ABO, incompatibility. This happened because of IgG anti-A and anti-B, which present in the our blood group of the mother are in normal condition, so that the erythrocyte of the neonates become the antigen target, which attacked by two types of antibodies. Transfusions of an ABO compatible unit could cause the antibody of the recipient to start an interaction with the surface antigens and the donor red blood cell. And if a transfusion compatible blood is given, the donor cells would be treated and the immune system of the mother would attack the donor cells. Next.
Symptoms and complications that might arise in the case of wrong blood group transfusion, specifically the ABO group incompatibility, are divided into several types, and one of them is the hemolytic transfusion reaction. The hemolytic transfusion reaction means that the transfused red blood cells, or the erythrocytes, are destroyed by the host immune system. Mild to severe symptoms can develop. It can start with some pain in the back, bloody urine, chills, and short of breath. In severe cases, acute kidney disease, anemia, lung problems, and even shock can also appear. The symptoms occur immediately, but in some rare cases can also appear hours later. In one case report from Japan, it is believed that the antigen-antibody immune complex is responsible for the initiation and the development of systemic inflammation. Next.
In the case of rhesus incompatibility that occurs commonly in newborn, the common signs and symptoms are: firstly, jaundice due to the high level of bilirubin from the red blood cells, heart failure due to the lack of red blood cells that make the baby's heart undergo stress to pump blood throughout the body, and pulmonary edema that is caused by the heart failure, where the heart cannot pump blood effectively, causing blood to back up to the veins from the lungs, increasing blood pressure and forming a fluid in the alveoli. Newborns that suffer rhesus incompatibility is born with many congenital anomalies and have a very high mortality rate of 60 to 90%. Next.
Differential diagnosis. So the diagnosis of appeal to ABO incompatibility includes a variety of circumstances involving transporting maternal antibodies through the placenta to the fetus, such as incompatibility of rhesus and cal system antibodies. The first is rhesus incompatibility. So rhesus incompatibility refers to a mismatch between the mother's rhesus and the fetus. It is usually associated with the development of maternal rhesus sensitization and unit hemolytic disease, or NHD. If a person's erythrocytes express rhesus D antigens, then the person can be classified as rhesus positive. Otherwise, the person can be classified into rhesus negative. If a rhesus negative mother becomes sensitive to the antigen and subsequently produces anti-D antibodies that combine and potentially lead to the destruction of rhesus positive erythrocytes, then this phenomenon will become clinically significant. Next.
Cal system antibodies is a rare case. Cal antigens are one of the antigens found in the surface of erythrocyte of people with positive Cal. As in the case of rhesus incompatibility, in the Cal system antibodies, the mother has antibodies against the antigen Cal. This will cause fetal erythrocyte hemolysis and an up of the HDN. Cal system antibodies can be distinguished by rhesus incompatibility by seeing the presence of Cal antibodies in the mother's blood and Cal antigens in fetal blood. As in the case with rhesus incompatibility, in Cal antibody system, it takes maternal sensitization to form anti-Cal IgG. In addition to causing erythrocyte destructiveness, IgG anti-Cal also depress erythropoiesis by causing erythroid destructiveness by macrophage in the fetus heparin. Next.
So for the prevention, first, if the blood incompatibility is occur on mother and her baby, the mother should be given injection of proteins that prevent her immune system from producing antibodies that will attack her baby's red blood cells. Second, for transplantation organ, we should check about RBC selection, plasma selection, and platelet selection. Third, any HLA identical sibling who doesn't have anticipated race underlying condition for their sibling that is undergoing transplant should be considered as a potential donor to prevent any blood incompatibility. Next.
Treatment focus on preventing the effects of the incompatibility. In most cases, the baby can be treated after birth with a series of blood transfusion, hydrating fluids, electrolytes, which are elements that regulate metabolism, and phototherapy. And on rare occasions, an exchange transfusion may be necessary. Full recovery usually occurs with no lasting repercussions. Phototherapy involves keeping the baby near fluorescent lights to help reduce the bilirubin in the blood. These procedures may be repeated until the Rh negative antibodies and excess bilirubin have been removed from the baby's blood. Whether it must be repeated and depends on the severity of the baby's condition. Thank you. Next.
For the conclusion, blood group incompatibility is a reaction caused by the binding of the blood group antibodies that present in plasma to the blood group antigens on the red cells. There are two risk factors for blood group incompatibility. The first one is during pregnancy, that caused by contradiction between the mother's and child's blood type, and the second one is during blood transfusion, that caused by errors when blood transfusion happens. When a mother's negative rhesus is exposed to rhesus D antigen, the antigen D notices a foreign trait similar to how virus and bacteria are noticed. Next.
So for the symptoms include jaundice, shortness of breath, increased heart rate, chest pain, low blood pressure, and dizziness. Common complications that can occur are back pain, bloody urine, chills, fainting or dizziness, fever, and flushing of the skin. Differential diagnosis for ABO incompatibility include KEL system antibodies and RH incompatibility. For the prevention, the mother should be given injection of proteins, but if it's too late, she needs to be monitored regularly to keep her baby safe. Treatment after birth includes blood transfusion, hydrating fluids, electrolytes, or phototherapy. Next. So that's all about our presentation. Thank you so much for your attention.